Ladies and gentlemen, I'm a maverick at work. I am passionate believer in blue ocean thinking versus red ocean thinking. I live by a book, which is my business Bible. It's called Blue Ocean Strategies. And I would highly suggest that you get a copy of that book, because it's based on real research of real existing companies and real existing industries. And what the book really says, that most of us in all different industries are remaining in the red ocean. We continue to do the same old, same old. We think we're a little bit better than our competitors, but in the end of the day, we are in an ocean filled with sharks, and it's filled with blood, because we're really competing head to head, but the value proposition for the customer is going down and cost is increasing. And the notion of the blue ocean is to become so distinct, so unique, so innovative, that you make your competitors irrelevant, and that you create a value proposition second to none, and you have an opportunity to lower your cost. So, let me illustrate that to you on one of my journeys in my career. Henry Ford Health System, a 100-year system, was able to open a brand new hotel in the suburbs of Detroit. And they decided to hire a guy from the Ritz-Carlton, which is me. And the pushback I got from the medical world was extraordinary. How can you put a CEO in a hospital who has no healthcare experience and comes from the Ritz-Carlton hotel company? So I came, and I thought it was an incredible challenge to show whether my leadership capabilities could be transferred into healthcare. The first question I asked, who's the customer we're serving? And West Bloomfield is a suburb where you have a diverse group of people living, from a Jewish community to Chaldean community, Asian and African American community. And I asked my marketing people, tell me, what do they look for? And they looked at me and said, well, Mr. Van Grinsven, that's easy. Let's do a focus group, and we can ask them what they're looking for. And I said, no, that's not going to work for me. So they looked at me and said, well, what would you do then? Well, I said, I want you to buy me a pair of silk pajamas. Silk pajamas? Yes, because I want to go and live with these people. I want to be in their homes. I want to see how they cook. I want to see how they pray. I want to hear what they talk about around the kitchen table. And they all thought I was totally crazy. But, ladies and gentlemen, for 6 months religiously, 5 nights a week, I went to all these people's home, and guess what I brought with me? I brought outstanding food with me. Because remember, when you break bread with somebody, the relationship is changing, and they are going to tell you things they never, ever will tell you in a meeting room with a flip chart. 6 months religiously led to the following. I decided that based on the feedback, I was going to not open a hospital. I actually was going to open a community center for well-being, where foremost, it was all about great clinical excellence, but I didn't have to worry about that. I had the Henry Ford Medical Group, one of the oldest employed physician groups in the country. But why couldn't we also create activities and programs for the physical and mental well-being of the communities we served? And with that, I decided then to say, well, wait a minute. What does that mean in terms of the design of the hospital? And the original design of the hospital was your typical, traditional, cold, clinical, intimidating design element. I said, we got to change that based on my pajama story. And so we changed the whole design, and we created a Northern Michigan sense, and this is what it looked like. Doesn't look like a hospital, does it? Looks more like a nice resort somewhere. Here's another picture. A stunning facility. And inside, the Northern Michigan sense came also out. So what did we do? We created, right at the entrance, a wellness spa for women, because I decided that everything we were going to do was going to be designed for and by women. Why women? Because women make 90% of the purchasing power in healthcare. It behooves me to really find out what is important to them. So when I went to these homes for 6 months, I really listened carefully what were the unexpressed wishes and needs of my customer, not the expressed wishes and needs. And because of that, we then created a wellness spa right at the entrance of the hospital. When you walked in, you saw this beautiful wellness spa. Then you saw a beautiful, incredible environment of retail. Not your typical hospital retail, but a 20,000 square foot retail space, which became the shopping area for the local community. Then we said, well, what about food? You know the traditional providers of food services. They cook out of a pack. They give you deep fried food. It's awful. So we blew up all the deep fryers, all the freezers, and we hired a celebrity chef who was passionate to want to make a difference for the people we served. But that was not good enough. Then we decided, well, why don't we also create the first hydroponic organic greenhouse in healthcare in the country? So we were now growing our own produce for our guests. I don't call them patients, by the way. For our guests, for the employees, for the communities we serve. And guess what? Every day I insisted that I wanted to see yellow school buses there, so that we were going to bring the school kids and they could touch the produce. And then afterwards, they would go and see the farmer. This is the farmer, and she would really entice them to start tasting how wonderful and how yummy the produce really was. And then we decided to create a 100-seat auditorium with a state-of-the-line kitchen line, so that we could do cooking classes for the community. People with diabetes, heart conditions, cancer, people like us who want to stay healthy, because food is medicine, food is healing. But that was not good enough. Then we had this enormous, beautiful atrium. And we said, well, why don't we create every Friday, Saturday, Sunday, we create beautiful concerts. And we pipe it into the patient rooms so that the patients can benefit from it. So instead of being a cold clinical space where the patients was pulled away from its community, we brought the community back and let the community embrace the patients. And then one day, I decided to stage weddings in my hospital. The doctors and the nurses went all crazy. They said, you can't do it. We are a hospital. We're not a hotel. I said, no, I'm a community center of well-being, and I want to do a wedding. And we did the first wedding. I paid for it, by the way, $40,000, and I made it a Ritz-Carlton plus wedding. And the end story is that at that wedding, the patients were asking the nurses, can you put my bed closer to the window so I can see the wedding party? It lifted up their spirits. On the balustrades, I had patients who were able to walk, and they were crying. It lifted up their spirits. Ladies and gentlemen, we did 72 paid weddings in that hospital before I departed. And it again created this whole sense of community. Are you surprised that because of that, we had the highest patient engagement scores in the country? We had the highest employee engagement scores in the country because I decided that I wasn't going to be a traditional hospital. I decided to become a talent-based organization where I only would hire my 1,600 stakeholders based on natural talents. I wanted them to have natural talents for relationships, natural talents for compassionate care. I refused 40 physicians because they didn't have talent for compassion, they didn't have talent for relationships. Then I cut out all the hierarchy and I empowered my stakeholders, who are the most important assets in your organization. I empowered them to really do what they know best, to surprise and delight the guest. Surprise and delight the guest in a healthcare setting. Yes, it is possible. And then we said, we're also going to make sure that we as senior leaders, that we will be servant leaders. And hence, not only were we the best in employee engagement in healthcare, we actually beat Ritz-Carlton, which did me a lot of good, and the Four Seasons in employee engagement. So, ladies and gentlemen, I illustrated this journey to you that in your industry, maybe it's time for you to stop the train. Maybe it's time for you to start thinking, am I in the red ocean or am I in the blue ocean? And if you're in the red ocean, what are you going to do to elevate yourself to a whole new way of thinking, where you are not afraid, that you are bold enough to really go beyond the boundaries of imagination and create for your discerning customer an experience blueprint second to none. Thank you.